How can multiple myeloma be detected earlier? Well, we know from 2009, when the definitive screening study was done, showing that all patients with multiple myeloma have a preceding phase of monoclonal gammopathy. That study showed, based on screening in close to 80,000 people, that all the people that have subsequently developed myeloma in a stored sample at the time of beginning of screening, going back, looking in those samples, that there was always monoclonal protein in the tube. So myeloma always comes out of a preceding monoclonal gammopathy. There is also evidence from genomic studies showing that the disease, although it has an average age of onset of around 70, if you go back in time, if you look at what's called mutational clock time, if you look at the evolution of the disease within a given person, there is genetic evidence that the disease many times starts around the age 20 to 30, which is very peculiar. And it may be even earlier, we just don't have the technologies to pick it up. So for sure, if a person is diagnosed with myeloma, 95% of patients are 50 years or older. Half of those patients are 50 to 70, the other half is 70 and up. And as I mentioned, 95% are above 50. So that means that 5% are before the age of 50. So there are patients in their 50s or 40s or 30s, and very rarely in their 20s can happen also. So how could you pick up all this? Well, you would have them to screen for precursor disease, and that is not yet standard of care. I'm involved as the co-principal investigator with Dr. Kristinsson in Reykjavik in Iceland on the iStopMM, the Icelandic screening study. We wrote that protocol together almost 10 years ago. Dr. Kristinsson is the lead PI. He's leading all the operations. A lot of data has been generated, but the main analysis is still ongoing. And the question is whether you can screen and have an earlier detection that would translate into improved survival. So patients have been screened in Iceland. We have screened over 80,000 people. And the study allows, by design, patients have consented to be screened, and half of them have been informed about their MGUS and they are followed, and the other half have agreed that if you're screened and found to be positive in the research, that you will not be notified by the research. So that means that the study will keep that information going forward and then see if there is a benefit in early identification and detection, because if you're informed, you will also be followed. So it's very difficult to do a study like that. And I think for legal and other purposes, I think it's very hard to do studies like that. Could never be done in the United States, for example. But in Iceland, it's legally possible. It's approved by the Ethics Review Board, and patients have consented to do it. And I think it's an important study. I think the study probably will show that there is a benefit. You can prevent, in particular, complications, because many patients are diagnosed when they have a fracture or renal insufficiency, acute renal failure. And you don't have to go that far if you screen and you follow someone. So it's a long and convoluted question, but I think that's where the field is going.